Continuing along now in our series here, getting everyone ready to go with everything they need to know for Milford's local elections, in particular, all of the positions that you will see on the ballot coming up in 2025. And we're so pleased to be joined in this interview by Paul Mazzuchelli, who wears a great many hats here in the Milford community. Today we'll be honing in on Paul's role on the Board of Health, but first and foremost, Paul, always happy to have you on Milford TV.
And
welcome.
thank you so much. Thank you for having me, and thank you for having the service, too, for the public, so they'll get a better understanding of what their municipal boards do for them.
Yeah, we're happy to do it. We're so pleased to be partnering with the Citizens for Milford on this entire series of informational videos. So, Paul, first and foremost, if you could sort of tell us in your own words the basic roles and responsibilities that are involved with being part of Milford's Board of Health.
There's a lot to it that people really don't see, because a lot of times a health department, especially a local one, is a victim of its own success. Like anything else, people don't really appreciate public health until sickness comes. So throughout the run of the day, people are going to work, they're going to restaurants, they're, breathing clean air and all that, but that's, something that's expected and should be. But in the local Board of Health, they're responsible for so many. When I'm asked to what does a Board of Health do? I say, well, just think of how many times it touches your life throughout the course of a day. You get up in the morning, the first thing you do is you go to the bathroom, you flush the toilet. That water now is contaminated, has to go somewhere to be cleaned so it doesn't cause any environmental health problems. You have a drink of water. That water that you have from the faucet doesn't come clean all the time, so public health makes it potable for you to drink. You have breakfast. That food that you're eating is inspected by public health from farm to table, especially locally. Okay, when it comes to your town, you get in your car, you turn on the ignition, and you ride away. That exhaust is now tested to make sure that it's at least safe enough for the environmental clean air. You feel healthy. That's because you had your vaccines through various clinics that the Board of Health had. So just with those examples, throughout the course of a day, how much does public health touch you? How much are you in contact with public health? And that's why a lot of people don't realize, well, what does the Board of Health do? You check restaurants, or do you condemn houses? And yes, we do. But we have a responsibility. And in Massachusetts, we're very unique, because each individual's municipality has its own Board of Health. You go as closest to Rhode Island, New Hampshire, Connecticut, that's the state Board of Health. Again, to repeat myself for effectiveness, each municipality in Massachusetts has their own local Board of Health. And that's fantastic, because that what your individual city or town would need, more than someone who's sitting in Boston behind a desk. And that's what makes it good. And like I said, we have a certain set of responsibilities that are called your minimum mandated responsibilities that the Department of Public Health puts out for us. That's who we answer to. We're an autonomous board, like the school committee is with the Department of Education. A local Board of Health has that responsibility to the Department of Public Health. Again, everything that has to do with health, safety, and the protection of the environment is what your local Board of Health is responsible for.
It's fascinating when you start to break it down like that, really starting to understand how many different aspects of society that the Board of Health has a role in. So with that in mind, Paul, with all of those different things that the Board of Health is monitoring, is taking care of, what does a typical week or typical month for a member of the Milford Board of Health look like from a time commitment standpoint?
The actual member?
Yes.
Okay. Well, I would like the member to be more or less in tune to what the office is doing. Don't forget, we have the opportunity to appoint an agent or a director, inspectors, clerks, to help carry out those mandated responsibilities. And to be in tune with the office is very important. to actually do their homework on what the next agenda would be, to help make the next agenda. And how they can get at that, too, is they talk to the office staff, talk to various department heads throughout the town. Most of all, more importantly, is the residents. What do they feel as though that could be improved health-wise, safety-wise, environmental-wise?
And then in terms of, for someone who may be interested in becoming a Board of Health member, what sort of experience is helpful? I would imagine that having perhaps some sort of medical experience may be helpful, but for someone who was newly interested in becoming part of the board,
Sure.
what's some valuable experience to bring to the table?
I would say their ability for leadership and for guidance, and to be under an obligation to find out what the current Board of Health is obligated in doing right now. Find out, go through the minutes of the meeting, interview the staff, find out how they can help, how they can be an effective member. And that's what I would recommend. Again, you don't have to be a doctor, or a lawyer, or a nurse. It would help. Believe me, it would help. But we also have our staff that does that as well. We have our VNA staff that does all our medical aspects of it, our disease investigations, our clinics, our screenings. I always would say, find out what a committee or a department needs, and if you can fulfill that obligation to make them better.
Excellent. In terms of the biggest challenges that a Board of Health member might face, now I know we're just coming off of a period of time where you may have faced your single biggest challenge in dealing with COVID and everything that came from that, but in terms of your typical day-to-day role on the Board of Health, what are some of the big challenges that you typically face?
Public health changes practically every day, let alone every year. But like, for instance, you take in Milford, for instance, one of the challenges that we have as board members is to now move this illegal conversion problem along. Okay, that's a public health issue. I know it's also building because they're illegally converting homes, but it's a public health issue because it causes potential health and safety problems for the occupants that are living there, for the neighborhood, and for the rest of our first responders as well. So, I mean, that would be a challenge that would come up. Another one would be, for instance, we just had our flu clinics. We have to keep the respiratory diseases down, the flu down, along with now COVID starting to raise its ugly head again in certain variants. So we have to plan those clinics appropriately. And it's good to be proactive instead of reactive. When you're reacting to somebody, the problem's already there, and it's a little more difficult to address. But when you're proactive, hopefully you can prevent it before it happens, and if it does start to happen, you're more apt to correct it earlier.
Really, really fascinating insight that you've been able to bring us today, Paul. So as we close things out here, another just sort of big picture question to finish out on, and one particularly useful to ask you, knowing that you have served in so many different capacities in local government during your career. Can you speak to the importance of getting involved in the local election process and being active in local government, why that is so important?
Absolutely. It's very important because when you're in that particular position, be it a committee, an appointed committee, or an elected board, you're representing the public. You have an obligation to them to make sure that if they have that trust in you, you don't want to disappoint them. And that's what I recommend to somebody. If they're going to run for office, please do, if you feel as though that you can do it properly and you can make us all proud of you and you can be a credit to the community.
Excellent. So again, we hope that these continue to be helpful to everyone to learn a little bit more about all of these individual offices and positions here in Milford, and certainly an inspiration to get more active in the local government process. But in the meantime, Paul Mazzuchelli, we thank you so much for taking the time.
Thank you so much for
appreciate
having
it.
me. Really appreciate it. Thank you.